right, that was a terrific way to end the session. We have about 10 minutes for questions. So if anyone has any questions, please come to the mic and state your name and where you're from. Maybe I will just lead things off. There was a question, you know, keeping in mind everything that's been presented and Danielle's last presentation, and perhaps I'll put this to all the panel members. Does anyone have any experience hiring a media consultant, you know, to help manage all this? Or do you suggest just a do-it-yourself approach? That was the question that came from the audience. Why don't we start at that?
No.
No one?
Yeah, I think that most large hospitals do have someone who's been assigned to this task, and I think you can get a lot of very good information. At Mount Sinai, we had, we're managing our Facebook page ourselves, but we had someone sit down with us just to help us to make sure that all the security settings were correct before we got started. It's a small investment. It's just an hour of your time to sit down with the consultant, but it can help to avoid a lot of embarrassment down the road.
At Vanderbilt, the folks who run all of our social media applications and do education for faculty about the use of social media is our marketing department. So.
You know, one thing we didn't really talk about in this course is all the specialized healthcare social media sites, you know, whether you're talking HealthTap or AVO or any of the other organizations. And I think it can sometimes be overwhelming to know where to start. Do you start with Facebook, or do you start with Twitter, or do you start with one of these specialized healthcare social media sites? Does the panel have any opinion on that?
Yeah, I think if some of the same statistics we talked about for generalized social networking sites show even greater use of sites like Sermo and others where physicians can share opinions, similar to what SAGES is doing within our own SAGES pages. And you know, physicians find that more comforting to use those closed sites, but I think they raise some of the same issues that we've talked about, and we haven't addressed those today. So it's going to be interesting to see how that plays out.
Yeah, I think where you get started depends on what your goals are. So I think Dr. Gwon gave a great talk about the value of LinkedIn as a way that you can take control of what's out there and put information that is going to be on the top of the list when someone Googles you, and your patients do that all the time. And then again, if you want to, you use things for like Twitter or Facebook more to establish a brand for yourself. LinkedIn is also doing that, but if you want to participate in the conversation, or again, one of my favorite quotations from Michele Ledgerwood in one of the first sessions that we have given on social media was that Twitter is your own personal set of research assistants, and you can, if you choose the right people to follow, they will keep you abreast of the news, and you don't have to go out and find it because it will find you.
I would just add really quickly on the issue of finding a social media consultant. There are a lot of people out there labeling themselves as social media experts. Again, social media is a relatively new set of platforms. There are varying degrees of quote-unquote expertise. Make sure you get a referral. Don't just hire. There are tons of people on Twitter who market themselves as social media consultants and experts. Really make sure you vet whoever is doing that for you, because it's very important to choose the right person for your organization or your specific needs.
Question at the back.
Vasquez, Chicago, no conflicts. Great panel. I enjoyed all of the presentations. They went by so quickly that it's essentially impossible to take notes on it. So I'm sure you've already got a question we sent from the back about where can we get copies of the slides so that we can read the material in a little more leisurely form.
And you can watch them on YouTube also.
Oh, great.
Yes,
Great.
SAGES YouTube.
Good, that'll be great. I have a question though for the last presenter. I'm concerned about this apparent conflict. If it's against the policies of Facebook and some of the other social media outlets to give out the username and password, and yet you have coaches and teams asking for the passwords and usernames so that they can monitor things. We've got employers asking interviewees for their passwords and so forth. Doesn't that automatically negate? I mean, shouldn't the account just be closed down and destroyed, and that ends the discussion? If they want to know about you, they can go on Facebook or Twitter or do whatever they want and find out what you've posted.
Good question. So there's a couple different aspects to that. From the student athlete perspective, the institutions, particularly in North Carolina, have set a policy that say either you friend a coach and they actually assign people to follow him, or you don't play. So if you want to be a student athlete at our institution, you are committing to allow us to monitor all of your social media, or you can't play. And if you don't want to allow us, that's fine, that's your right. From a non-student perspective, the first lawsuits are out about that. It's in the state of Maryland, and the Department of Corrections was requiring applicants to list their username and their password to their Facebook account on their application. And they justified it saying that they wanted to be sure not to hire people who were affiliated with gangs, and they wanted to search the websites for photographs of those applicants using gang symbols or gang dress. And so that's in the courts right now. 2 states have proposed laws, Maryland and I think Virginia, making it illegal to ask for your user account. The way that some institutions are getting around it is not asking for your name and your password, but when you are physically there and interviewing, requiring you to log into your account so that they can visualize your friends and your photographs.
So, but if they can request a friend status, but that's a little bit different than grabbing your username and your password.
Yes, it is. But they are doing both.
Both. Okay, thank you.
Yes.
Osama Hamid from Penn State. You know, I've noticed recently there's like increasing number of apps, like something called Doximity, where they're trying to link physicians only. So you have to be a physician to be part of this group and part of these discussions. And it's, I think, a great platform, but what's the panel perspective on these apps that's only for physicians, and how we should trust them, like in terms of our comments and our discussions? And they claim they're very secure, only for physicians. You can post whatever you want about patient, about questions regarding clinical cases, but is this really trustworthy, and can we go through this pathway?
I mean, maybe I'll comment first, as I think someone mentioned. I think on some of these websites, there are no guarantees, and there probably are ways to trick the system. I will say, as part of our own, Sage's websites, that you do need to be a paying member to have access to them, to the features that will allow you to do some of those things. So, is that to say it's impossible to kind of work around that? I can't think of a way right now versus the other websites, but I guess I can't say that it's impossible, but I think it is more secure that way.
Yeah, I think you just have to be careful. I would recall a motto from my surgical residency at Duke: trust no one, expect sabotage. But I think with all of these, again, whenever you're talking about patients or things that are confidential, you have to be absolutely sure.
It's not about patient, information, about like in clinical cases, discussing like difficult clinical situations, complication in the OR. This is what they claim that their apps is for, like called Doximity apps. You can ask your peers questions and somebody from where can answer you. What's you guys' perspective?
It's doable, but you have to, again, be careful. If my username on my account was Danielle Walsh, MD, and it said that I'm from Greenville, North Carolina, and I said yesterday I operated on an 18-year-old with X, those pieces can be put together to create an identifiable situation. So you might want your username to be pediatric surgeon MD, and you might want to just put North Carolina instead of Greenville. And you won't say that it was yesterday. You'll say a teenager presented with such. So you just have to sort of de-identify as much as you can. Yes, you should have those conversations. That is one of the benefits. We want you to interact, but do so very carefully.
And all those would be discoverable evidence and very easy to search, I would presume?
Yes.
And also, be careful. You're asking people that you don't know for medical advice on how to manage your patients, which may be as good or maybe not quite as good as asking a colleague at home.
All right, thank you all for attending. I think we've completed the time we have allotted, but I encourage you all to come up, and we'll be happy to answer any questions personally or find us on Facebook, Twitter, or LinkedIn.